Hello, my name is Denny, and I'm a nurse leader in the emergency department at a large academic medical center here in Arizona. Throughout my nursing career, I have seen literally hundreds of patients unjustly dependent on opiates. I'm proposing a statewide policy in which emergency departments in public hospitals in Arizona will only allow physicians to prescribe a 3-day supply of opioids and will be completely unable to prescribe long-acting opioids. With this policy, there will also be no refills for lost, stolen, or destroyed opioid prescriptions. I'm presenting this policy brief as a result of the steady flow of patients I have seen presented to the emergency department with a supposed need for opiate pain relief. I've also spent time as a nurse in the acute care medical surgical setting in which physicians often feel they have no choice but to treat their patient's pain with whatever the patient states they need to report relief. There are patients with legitimate and chronic pain management needs, and many more with what started as a small health concern and turned into a full-blown opiate dependence or addiction. As healthcare clinicians, be us nurses or physicians, I believe it is our obligation to do everything we can do to slow down this epidemic. According to the Office of National Drug Control Policy, the current rate of drug-induced deaths in Arizona exceeds the national average, as does the non-medical use of pain relievers by persons ages 12 and over. Ultimately, if a patient presents to the emergency department with a medical issue such as pancreatitis or cellulitis, and the patient has a relatively high home dose of opiates reported, it is not the job of the inpatient clinician to put the patient through the withdrawals of reducing or eliminating their opiate regimen while treating the presenting problem. This is one disadvantage or exclusion to the proposed policy and a small piece of the opiate battle which cannot justly be tackled at this time. From the perspective of the emergency department physician, however, if there is a hard limit to the type and amount of opiates they are able to prescribe in the emergency department, they cannot be considered a contributing factor to this epidemic. According to Taylor and Ballinger in Health Policy, Politics, and Professional Ethics, published in 2015, the goodness of an action lies in the intent and integrity of the human being who performs it. The rightness or wrongness of an action is judged by the difference it makes in the world. If healthcare clinicians do their part to reduce opiate dependency within their hospital emergency departments, the impact on the state of Arizona has great potential. This is one small but powerful step in fulfilling the social justice obligations of the healthcare provider.